Welcome back to the channel, guys. Last time we talked about the importance of exercise for persons with hypertension. We looked at both the benefits of cardiovascular training, low intensity of course, and strength training. Today's video, what we want to do is look a little bit more closely at some of the considerations you need to keep in mind when you're going to do strength training. As always, if you're going to be doing strength training or cardiovascular training, you should check with your doctor. Make sure you get a stamp of approval before you get into it. And the first and most important thing is your warm-up and your cool-down. Now, because weight places a lot of physical strain on the body, it will cause the heart rate to increase, and with that, the pressure to increase as well. For that reason, you want to ensure that you warm up properly. I'm not talking 5 minutes. 10 minutes is the ideal time. It could be a little bit more, because what you're trying to do is gradually increase your heart rate so that when you start lifting the weights, there won't be a sudden spike in your heart rate and your blood pressure. The same thing goes for your cool-down, because what this does, it helps to gradually lower your heart rate so that you can get back to normal activities without having to leave with an elevated blood pressure. This could be done on a treadmill, this could be done on an elliptical machine, or even on a cycle here where I've got my resistance pretty low and just cruising to warm up the body. What you want to avoid are Stairmasters. If you're new to Stairmasters, you will quickly find out just how fast that machine raises your heart rate and your blood pressure. So steer clear from the Stairmaster at the beginning. So now that you've completed your warm-up, there are some things you need to take into consideration when you're doing weight training. One of the things you definitely want to avoid are inverted exercises. Inverted exercises are simply exercises where the load is located above your heart. And this will include exercises like the overhead press, whether you're using a dumbbell or a barbell. And another popular one would be the angled leg press. Now, does this mean that you can't work those particular muscles when you're in the gym? It definitely doesn't. Remember, when you're doing a leg press, your target are primarily going to be your quads. You can do leg extensions, and more so if your gym has the equipment, you can do an alternative, and that would be a seated leg press. You see, when you have the load above your heart, it amplifies your blood pressure even more than a regular exercise would. And that's why you want to avoid it. You want to avoid the overhead presses, you want to avoid the angled leg presses, and even in addition to those there's some other movements that you will probably want to steer clear of at your early stages of lifting weights when you're hypertensive. And that would be the deadlift. Remember, you're a beginner. You want to start with simple movements, single joint movements, not as many compound movements, except if you're using a machine that has you in the right position. So start things off with simple movements like bicep curls, tricep press downs as you start your exercise. Even leg extensions if you're going to be doing legs. And from there, you move in as your workout progresses into more compound movements like your seated leg press, seated chest press, etc. Keep in mind, you're not trying to fix the problem overnight. So when you're choosing your reps as well, ensure your rep ranges are somewhere between 10 to 15 reps. Keep your weights light to moderate. Breathing in through the nose and exhaling through the mouth is usually the easiest way to breathe. Some persons may want to do strictly nasal breathing, but that does make it more difficult when you're exercising. And since it's anaerobic training, which means you're training very often without sufficient oxygen, you want to make sure you're giving yourself the best opportunity to get as much oxygen in between sets. So breathe in through the nose, exhale through the mouth. Another interesting thing about that is when you inhale through the nostrils, your body actually increases its amount of nitric oxide in your blood. And if you know anything about nitric oxide, what that does, it opens up your blood vessels. And for someone who's hypertensive, having your blood vessels open up wider during your movements means that there'll be less pressure in your blood vessels, regulating your blood pressure better and helping you to get where you want to go without problems. Now, as I've mentioned many times before, the best type of training is a combination of both cardiovascular training as well as strength training. And even in that previous video, we talked about how many benefits like post-exercise hypertension you can get from cardiovascular training. So combine the two, have days when you do cardiovascular training, days when you do strength training, alternate between those days. And the more frequent you can do it, is going to be the better for you. Just remember to pace yourself. Start small in terms of your duration, maybe 20, 30 minutes. And as you get better, as you notice you can do more without any signs that you've crossed any lines, then you can move forward and increase that duration. And you'll be on your way to living a better quality of life. And for those of you who don't have hypertension, start now so you don't have to worry about that tomorrow.